Hi everyone, welcome back to my office. Today I'd like to discuss my approach to the erythematous rash in the context of Global Morning Report number 192, which is a case from NYU and Dr. Wong. In this case, a 58-year-old woman presents with confusion, fever, and a lower extremity erythematous rash. The first approach in evaluating the erythematous rash is to determine whether it blanches or not. A rash that blanches is consistent with the vasodilatory process. A rash that does not blanch is consistent with the extravasation of red blood cells. So if you're in a warm environment, your vessels vasodilate, resulting in a blanching rash. Some viruses and drugs can also cause blanching rash. And how can you determine if the rash blanches? I recommend using a clear ruler or a glass slide to determine if the rash blanches. I don't recommend using a drinking glass, but I think this gets the point across that you can easily see what's going on the other side of the glass. We learn in this case that the patient's rash does not blanch. So this suggests a process of extravasation of red blood cells. Depending on the size of the rash, you can identify it as petechiae, which are small erythematous non-blanching rashes, purpura, or ecchymosis. These are just a spectrum based on size, but the underlying pathophysiology is the same for petechiae, purpura, and ecchymosis. Once you identify the rash is non-blanching, the next step is to determine whether it's palpable or not, and the way you can do this is close your eyes using the appropriate contact precautions. See if you can palpate the contour of the rash. If you can, then that suggests a palpable rash. A palpable rash is consistent with vasculitis. A non-palpable rash can still be due to vasculitis or pathology at the vessel, the clotting factors, or the platelets. When you do have fever and rash, there's a number of infections you should consider right away, including strep, staph, meningococcemia, and Rocky Mountain spotted fever, and the right demographics. In this patient, they biopsied the palpable rash, and it ended up being leukocytoclastic vasculitis, which can be caused by a number of processes, including ANCA-associated vasculitides, infections, and drugs. Ultimately, the patient's blood cultures grew positive for Streptococcus galliticus, formerly known as Strep bovis, and the patient was diagnosed with infective endocarditis. Thank you so much for your time. If you have a different approach to the erythematous rash, please include it in the comment section.